A few months ago, Hartford HealthCare began conducting a research study to determine how many staff had developed antibodies against COVID-19. What did they find? I'm joined by Dr. Pavlos Papasavas, the Director of Research at Hartford Hospital. Thank you for being with us.
Thank you for having me.
So how many staff have you tested, and how many did you find actually had the antibodies?
We have tested more than 6,800 employees. 5,000 of them had one blood draw, and about 1,800 had a second blood draw.
And how many actually had the antibodies?
Approximately 77% of our employees have detectable antibodies. So it's about the number that we expected to find. If you compare this to the public, there's no antibody studies in Connecticut that I know of, but the rate of positive PCR tests in Connecticut was about 1.1%. So definitely higher rate of antibodies in the healthcare employees, although it's not an apples-to-apples comparison.
Okay, I just want to clarify the number. You said 7% had antibodies, or 70% of your people? Seven. Yeah. Okay. All right. So what is the data telling you? Are there any common denominators? Like, was it mostly the frontline staff who had the antibodies?
So we asked employees to grade their exposure to the virus: high exposure, intermediate, and no exposure. And the employees who had a higher exposure, like daily care of COVID patients or almost daily, had about 9% positive antibodies, versus the employees who did not have exposure was about 3%. And from the employee categories, we found that nurses had about 9% rate of antibodies, followed by advanced practitioners 5% and physicians 3%. So the frontline employees were affected the most, and that makes sense.
Do you know if most of them actually got sick, or if they were asymptomatic, or what else have you learned from the data?
So we're still analyzing the data. The good thing is that all the employees who tested positive for COVID, 99.8% developed antibodies. So that is a useful information. We do not know how long these antibodies will last in the body and how much protection they will have. But the positive message here is that the employees who use the personal protective equipment, they get protected. And if they follow the state guidelines outside the hospital, they protect themselves and they protect also their patients.
That's good to know. Some interesting information, especially as people are opening up. Important to keep ourselves protected, too. Dr. Papasavas, thank you so much for being with us.
Thank you so much for having me.